Doctors, my name is Johnny Carbarba II. I'm a first-generation student from rural Ohio, Appalachia, and a recent graduate from the Ohio State College of Medicine. I'm very honored, humbled, and blessed to be joining on as a dermatology resident in the class of 2029 at the Ohio State University Wexner Medical Center as well. Today, I'm talking about preparing for the Step 2 CK exam. I've received countless requests on Step 2 prep advice, etc. And so to best serve you all, I'm going to create a video that you can watch, you can rewatch, you can share with your friends, and just hopefully that this helps you get the points that you so very much deserve on test day so that you can score big and that you can get to the residency that is best for you. And so today we're talking about the path of the 99th percentile and creating a treatment, or rather a study plan tailored to the patient, which is you, my friend. And so let's go ahead and get started. So I just want to share some background about myself. Here's my test score. I scored 276 in the 99th plus percentile on the Step 2 CK exam. I also did a master's degree here at The Ohio State University. And so I also had a scored Step 1 exam in which I scored 263. And I want to go on that little tangent to say that Step 1 and Step 2 are so similar in preparation and ways that you really understand the material, because really there's only so many ways you can ask about inflammatory bowel disease. On Step 1, they're going to ask you about the pathophysiology. They're going to ask you about the mechanism of the drug to help treat this. It's going to be the same stem at the very top with a different question at the very bottom. On Step 2, they're going to ask you for the next step in management. They're going to ask you about, etc., things more clinically relevant. So really, by saying that, is I hope that you are inspired a little bit that your Step 1 prep really helps you with your Step 2 prep, and all that basic science that you learned in the first 2 years of medical school really help prepare you best for this Step 2 CK exam. And so I also want to give you the background that I'm very humbled and honored to have graduated valedictorian from my class at the Ohio State College of Medicine, and also that I am a first aid author. I helped publish the Step 2 CK book, I helped publish Step 1 Video Express lectures, flashbacks, and I'm currently an editor on a high-yield clinical reasoning project with them. I say all of this because I want you to know that my background going into this exam was to score as high as possible. And I'm very humbled and honored that I was able to get a score that really reflected the work that I put into it. And I just remember feeling so much relief and so much happiness when I opened my score and was seeing that I even scored higher than my goal score for Step 2. And so I really want to help pass on anything that I can information-wise to help you have that same feeling when you open up that test score, that you'll be able to get the score that you need to get you into the best residency for you. And I really hope that you have that moment, and I really hope that I can be a very small piece in your puzzle as you prepare for this really exam that you really need to score high on. So with that, let me ask you a very straightforward question, student doctor, and that is, do you know how to do division? And you're like, Johnny, what are you talking about? Do I know how to do division? I'm in medical school. Of course I know how to do division. Good. I want you to take the total number of days you have for your Step 2 CK prep, whatever that is, and the total number of questions and a question bank. Pick out your best question bank that you want to use. There's several out there. There's First Aid, there's UWorld, there's AMBOSS. Pick out a question bank. You need to get through all of it. Remember, this is the path to 276. This isn't the path to, scoring and just going to pass, which is great, depending on your goals, depending on your career. That's great. This is a path to 276. Find the test bank that you can get through all of it. That's how you're going to score big on test day, because I want you to know that I firmly do not like flashcards. And I know it's like, Johnny, what are you talking about? I really believe that you should do what I'm putting here in the top left corner, that questions are your flashcards. And when you study a flashcard, really a flashcard gives you a discrete fact about one specific thing, right? When you read a Step 2 question, or you read a Step 1 question, or you take your in-class or your in-house exams, there's so much in that stem that you cannot fit on a flashcard. The stems of the question really give you so much detail. It's like a flashcard review of inflammatory bowel disease. Every time you read a stem or a vignette about inflammatory bowel disease, bam, that's another rep of inflammatory bowel disease. Every time I look at the stems as my flashcards, it's like, oh, okay, yeah, we're talking about inflammatory bowel disease, we're talking about this, talking about that. Perfect. It gives you the vignette. It gives you the epidemiologies, maybe some risk factors, some clinical findings, some pathophys. It might all be in that stem, but I don't believe in flashcards. I never used them. I said, let me get through as many questions as I possibly can, because there's only so many ways they can ask you a question. And so I want you to take your question bank, divide it by the total number of days that you have for your Step 2 prep, and really hammer those home. And I really want to tell you, depending on when you watch this video and your phase of your career or your studies in medical school, your preparation for this exam really began in your M1, M2 year when you were studying all that basic science, because the vignettes are exactly the same pretty much. And it's the last question at the very end. For step 1, it's what's the mechanism of action of blah, blah, blah. What's the pathophysiology of blah, 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 blah. On step 2, it's, what's the next step in management? What's the next step in diagnostics? What's the risk factor for this, etc. It's more clinically relevant. But really, that STEM still stays the same. So you really started preparing for this exam in your early years of medical school. And I really want to tell you that really, preparing for step 2, it really doesn't start right when you get in your step 2 period. Really, that third year of medical school, when you're taking all those shelf exams, that's when it really, I really thought about my third year. I'm like, great, I have a year to study for step 2 because I'm going to be hammering home practice questions. I'm going to get through all of, more than one question bank. I did UWorld, I did AMBOSS, I had first aid questions I got through all of those. I did the American Academy of Family Physicians, AAFP. I did all their questions. Those are free, by the way. There's like 1,600 free questions. I just put them on my phone. Instead of people like doing flashcards, I just did practice questions. Why? Flashcards, that's one fact at a time. Practice question, there are just so many facts packed into just the question. So I just pull that up. That would be my little flashcard to do the AAFP practice questions. Also did all the MBMEs, do all of those. So high yield, so great for step prep. And really you're preparing for your shelves along the way. So you're really getting an in-depth dive. I also did the pre-test books. And I'm happy to go into other resources I use. But the bottom line is I tried to go through as many questions as I possibly could because there's only so many ways they can ask a question. And that's why I really want you to take this to home. That's my first point to you. Questions are flashcards. And you ask, Johnny, what's my study schedule? Your study schedule is as simple as taking the total number of questions in a question bank that you choose to get through and the total amount of days that you have. And that's your whole study schedule. I will say that I was doing about 100 to 120 questions a day when I was in my step 2 period. I did about 2 months of just like dedicated step. I was on a longitudinal rotation, so I had some clinical rotation days in there too. But more or less about 2 months of step 2 prep that I did, mixed in with some rotations as well. And so that's what I did, and really just try to get through the most amount of questions as you possibly can. And I will say, I'm telling you now that, I scored 276, but I'm not saying it always looked pretty. Sometimes I was so tired, I was like, oh my gosh, I cannot do any more questions. I remember waking up one morning, I was like, man, I just don't know if I could keep doing questions. I literally opened up an app for UWorld on my phone, and I started doing questions on my phone, and I was like, okay, I'm just going to wake up every morning, and I'm just going to do questions on my phone while I lay in bed, whether they be timed, whether they be untimed. And that was the way I got my day started. I'm like, okay, 20 questions to get out of bed, 40 questions to get out of bed. I know it sounds crazy, but I met myself where I was. Energy-wise, mental health-wise, that's what made it healthy for me. And sometimes I'd go on walks. I'd be like, you know what? I need to go for a walk. I'd take my phone, I would do, an untimed or timed question study, and I'd go for a walk, and I'd just be answering questions on UWorld. My poor neighbors probably thought I was crazy. I actually made some good friends in that pathway. A couple of my neighbors brought me out cookies because they saw me walking so much studying. So I want you to take away from that is to win the day. Do the best you can to win the day. Can you do 5 questions one day? Do those 5 questions. Can you do 120 questions in one day? Do 120 questions. I'm telling you that you just have to win the day. Do the best you can for yourself in that day. It may not be 120 questions. Some days I got through 160 questions. Some days I even got through like 180. I was on fire. Other days I'm like, I don't know how I'm going to get through 20 questions today. Just do what you can to win the day. Just do what you can to win the day, whatever that means to you. And that's all I have to say about that. And so let's go through a question together and show you kind of how I best approach these. And so this question is from the test makers themselves for the Steps 2CK. I also want to say before each of your shelf exams, you can actually go on the USMLE website and you can hit practice questions for each shelf exam, like OBGYN, family medicine, all those. They'll give you like 20 free practice questions, no explanations, but 20 free practice questions. I always did those the very night before all my shelf exams, and they were very high yield for the exams, to say the least. And so how do I approach the question? No matter the exam you're taking, whether it be step 1, step 2, your in-house exams, board exams in the future, now, present, whatever. Read the last question. Read the last question. Sometimes you don't even need the top part. Read the last part of it. So my eyes, immediately, every question, train yourself, discipline. Serum studies are most likely to show which of the following sets of findings in this patient. Just real quickly, just scan. I already know potassium bicarb down. I'm already thinking what I already know this is going to be. It's probably going to be about vomiting, probably going to be about diarrhea. It's going to be something along those lines. That's how they like to ask electrolyte questions. Now, my eyes are going to go back up here. 17-year-old girl. She's vomiting. This is a binge purge. I don't even need to read the rest of it. And I mean that very humbly and respectfully too, but when it comes to board questions, you gotta get the repetition down. And I tell you this because by looking at this question, and eventually you'll see here, she induces vomiting several times a day each binge and has developed pattern of binging and purging every evening. I did this question without, I went through this before, but I went through this question and I did it on purpose because I wanted to show you guys that really this is like riding a bike. Once you do so many questions, you do thousands and thousands and thousands of practice questions. Eventually, you just start riding a bike with them. You start noticing patterns. You start noticing things that you just can't even explain. When people ask me to help them prepare for step 2, sometimes it's hard because there's so many little details about how you prepare. So I hope this helps you. And really, I want this to become like a reflex for you, that you can just read something, serum studies, potassium bicarb, boom, bam, you get the vignette, you're ready to go. I will say before I took the step 2 exam, I was sleep deprived. I only slept like 2-3 hours. I was so nervous. I couldn't sleep. I was like 2-3 hours of sleep. And, I just, the exam means so much. And I was going away to do an away rotation. I had to take it that day. I had no choice. It was locked and loaded. It had to be that day. And so I knew I had to show up and do my best. And I was very blessed that when I showed up there, I started taking the exam. And when I started doing my questions at home, I would do some untimed. I do timed again, win the day. Most of the time I tried to do timed just to get like a timing down. But whenever I did timed exams at home, I really was taking the full amount of time. Like I was like, oh my gosh, I only got 30 seconds left and I just got done with the last question, or I reviewed a couple of the ones I had flagged. I'm like, gosh, how's this going to be on test day? Well, let me tell you, on test day, I was finishing like 20 minutes ahead of time. I was like, oh no, I either don't know what I'm doing. And I started going back to some of the questions. I was like, I think I'm right. So I just got into such a groove. I just got into a groove to where my training and preparation took over. They say success occurs when, success occurs when preparation meets opportunity. Success occurs when preparation meets opportunity. And I felt like I prepared so hard. I did so many thousands of questions over my career. I did so many things that when I was sleep deprived, when I was nervous, it took over like riding a bike. I just got in this groove. I mean, when you're riding a bike, you don't think about the pedals. You just think about, the path in front of you. You're looking and you're attacking. You're going on the adventure. And that's how I hope you get on test day. You get in this riding a bike groove. If you can find that in your studies, if you can find what it means to ride a bike when you do practice questions, you'll know exactly what I mean. They just become so natural to you that it just feels second nature. And I know I was sleep deprived. I was nervous. I knew I needed to score well. I was going in the dermatology. Went in the dermatology. I knew I needed that board exam score. Plus, I wrote for First Aid. I helped publish the Step 2 CK book before I ever took Step 2. And so I really needed to prove that I was the person that was best for these things, that I could really accomplish the goals and really make the people who put me in these positions proud. And praise the Lord, I'm very blessed. I feel that I was able to do that with my test score on test day. And that's what the feeling I want you to have when you open your test score. And that's why I'm so passionate about going through with this to you. And you can do it. You can do it. I'm a first-gen student from rural Ohio, Appalachia. Every test score I've taken, every test I've taken throughout my medical career, from my ACT to my MCAT to my Step 1 to my Step 2, my scores have gone up. And so I just want you to know that you can do this no matter what you may feel in your life, no matter where you may have come from in life, no matter your background. You, looking at this computer screen right now or looking at your phone or wherever you're listening to this, you can do this. I believe in you, but it's only going to happen if you believe in you. And I hope you do. And so enough of me talking about that. Let me go through this question with you. Again, we're going to be disciplined. We're going to do it just as said. Serum studies are most likely to show which of the following sets of findings in this patient. Potassium bicarb, it's an electrolyte question. We can do this, guys. We can do this. Go up to the top. 17-year-old girl comes to the office for an examination prior to entering college. She reports that she feels well, but is nervous about leaving home for the first time. She states that she has tried to diet to improve her appearance, but the food restriction often backfires because she becomes hungry and then engages in episodes of binge eating. She reports a loss of control during these episodes, saying, "It's like I stopped thinking at all, and before I know it, I've eaten 2 pizzas." She induces vomiting several times during each binge and has developed a pattern of binging and purging every morning. You guys probably started to get a little bit glary eye right there. This is completely, you don't need it. Maybe the epidemiology of the 17-year-old girl. But right here, once they say it's, they're in vomiting, bam, it's done. It's a vomiting electrolyte question. You can move on. I always recommend just kind of briefly going through this. I would never have read this in this much depth during the exam, but I just would be like, okay, I already got the information I need. Serum studies, 17-year-old girl, vomiting. I already know what the question's trying to ask me, but my eyes would still go through this very quickly. I would just kind of look through here. And this is what I mean about flashcards. I'm going to pause right here. Physical examination shows dry mucous membranes because she's losing volume. Erosion of the enamel lingual surface of the front teeth. That's because the acid's hitting the teeth, dissolving the enamel. Hypertrophy of the parotid gland. That's because the bicarbonate is coming out of the parotid gland to try to neutralize that stomach acid coming up from the esophagus. But look how quickly I was able to tell you exactly why all these things were there. And I hope you realize that's a flashcard. I've already reviewed, bulimia right there. This is another flashcard. I got the whole vignette, got the epidemiology, got the serum studies once I get the correct answer. There's so much you can learn by thinking about your questions as flashcards, and I really hope you take that to heart, because that's how you score big on test day. And so by saying that, I also want you to know that you're preparing for the next question. They're probably going to say fullness of the cheeks, and they're going to give you some girl like this. Maybe it's a male patient. They say fullness of the cheeks or something. They're going to try to throw you off with the epidemiology or something. But you're going to know, oh, maybe they're talking about hypertrophy of the parotid glands. Maybe that's what they're trying to get. Bilateral. It's not unilateral swelling of the cheeks. Maybe it's a tumor if it's unilateral, but it's bilateral. So oh my gosh, it's got to be maybe they're vomiting too or something like this. These little things are what adds up to being able to score big on test day. So let's go ahead and answer this together. Okay, so if we're vomiting, we're going to be vomiting up electrolytes. So the potassium has to be decreased. That means these questions are all done, right? C through F, done. I know it's A or B. Now I can close my eyes and still get a 50% chance of getting this question right, whether I mark A or B. But if you think about it, if you're losing stomach acid, right? We're losing acid. What's going to happen to the serum? How could your serum be acidic if you're losing acid? So it has to be basic, right? If you're losing acid, you're going to make a more basic environment. Bicarb is more basic, and so the bicarb is going to increase. The correct answer is B. And I put this up here. Maybe you learned Henderson-Hasselbalch back in the day, but you don't really need it. This is what you need to answer acid-base questions, if you think about it, because it just really helps you understand how bicarb relates to pH and how CO2 relates to pH. And I want you to ask your question, because the next column here, they're going to do 3 columns, right? What's the respiratory compensation, right? What's the respiratory compensation for this? And so I want you to go through that. But you can just use pH as equal to the bicarb over the CO2, right? And I want you to think about, okay, if I'm becoming more alkaline, I'm vomiting up stomach acid. There goes the stomach acid. Now my blood's becoming more alkaline, more basic, so the bicarb is increasing. So to combat a more basic environment, a metabolic alkalosis, this is what this is. This would be actually that's the other thing. This question's also going to have, see, these things just come into your mind when you start doing these. Chloride, what's going to happen to chloride? I want you to think about this for yourself. I'm going to just pause for a minute. What's going to happen to the chloride? It's going to decrease. It's going to decrease because hydrochloric acid, HCl, you're going to be losing the H, the hydrochloric, the acid, the proton, the H, and you're going to be losing chloride. So this is a hypochloremic, hypokalemic, metabolic alkalosis. Hypokalemic, hypochloremic, metabolic alkalosis. So what's the opposite? How are we going to have a respiratory compensation then? It's going to be the opposite. It's going to be a respiratory acidosis. So they're going to put over here, what's going to happen to the CO2 to compensate? What's going to happen? Do you know? Well, it's very simple, because I just have to pick out the one that decreases the pH. And that means if I look at my little formula here, CO2 is going to go up. And so if CO2 goes up, the pH goes down. And so that's how you use this little equation right here to help understand the compensation, help understand what's going to happen in all of this. And so I just wanted to share that little tidbit that this is all you need from Henderson-Hasselbalch to answer any bicarbonate, any acid-base, thing. So if you have a metabolic alkalosis, compensation is going to be respiratory acidosis. And so let's go through one more question together. And so, again, what do we do, student doctors? We go to the end. And maybe the rookie goes right here. Which of the following is most likely diagnosis? No. Look how little information is here. Test makers are doing this. And I know they're doing it on purpose because I've helped write questions. And I do it on purpose when I help write questions. I put enough information down here for you to get the question, if you know enough, and be able to move on. Test day, I will tell you this. I'm looking at the clock. I don't need to spend much time on this. An x-ray of the left knee shows calcification of the synovium, which is the following most likely diagnosis. This is pseudogout. The question's done and moving on. That took me 3 seconds. I don't need anything else. The rest is just smoke and mirrors. Why would the left knee have calcification of DVT? No. Gonorrhea? No. Gout? That's going to be the crystals. Nope. Hemarthrosis? Nope. I know why they put this here. I would have put this question here because hemochromatosis is classically associated with pseudogout, and hemochromatosis, you can have calcification of that synovium or even the cartilage there. And so I would have put that there too, because it's a good one if you're not paying attention that you could choose hemochromatosis, because hemochromatosis is going to have these findings. That's why I put that there. I thought that was brilliant, whoever made this question. But the answer, it's not septic arthritis either. It's pseudogout. We're done. That's the only thing here on this list that causes calcification of the synovium. Pseudogout, done. Check it in. We're moving on. It took me 3 seconds. That's probably why I finished early on test day. It's because I think the blunt Appalachian came out in me. The blunt rural Appalachian. I'm like, I'm just, you're tired, you're nervous. What are you going to be grounded to? People always say that you have a potential. Are you going to reach that potential? It's like, some people think if you're relaxed, if you're in a good state of mind, you can reach that potential. But I don't think that we should ever look at ourselves clinically as doctors or test takers as somebody who's, how high is my ceiling? I don't care how high somebody's ceiling is. How high is their floor? What are you able to do on a bad day? How high is your floor? When a patient and you're sleep deprived and you're trying to take care of them, how much can you focus? What is your floor? I don't care about your ceiling. We all have these amazing potentials and, overachieve. No. What's your floor? What you want a bad day? What you sleep deprived? 2-3 hours of sleep. What you want a bad day? Me on a bad day taking this exam was a 276, which I'm so blessed and humbled and honored to have gotten. But that's because I did thousands of questions. I wanted my floor to be so high that even on a bad day, I could get a score that represents me. My goal score was in the 260s for step 2. Very honored to get that 276 because my floor was high. I want you to focus on your floor. Don't look at your ceiling. Get your floor. You get a high floor, you're going to score high because even on a bad day, you can have an excellent day. And so I'll go through this questions with you guys just in this. A hospitalized 57-year-old man has had severe progressive pain in his left knee since awakening 2 hours ago. He was admitted to the hospital 2 days ago for an AMI. Cardiac cath showed an occlusion of the left anterior descending artery, underwent placement of a stent. Current medications include aspirin, metoprolol, lisinopril, simvastatin, clopidogrel, and heparin. Vital signs are normal. Examination of the knee shows a large effusion. The knee is hot to the touch and erythematous. He holds the knee on 30 degrees of flexion. The pain is exacerbated with further flexion or extension. Laboratory studies show, and then here's the findings here. And so I want you to know, you could really use this backwards, right? Because this is a vignette for pseudo-gout. Study the vignette. What does this vignette show me? Vital signs are normal. Oh, he's afebrile. Interesting. Okay, you could have maybe a slight fever with pseudo-gout, but it's not going to be a rip-roaring fever, nothing like crazy like 102, 103, 104. Septic arthritis is that, so you can get rid of septic arthritis. You look at the leukocyte count, you can get rid of that too. They're trying to get you. I'm surprised they didn't put, I'm surprised, they didn't put, I guess they could have put, uric acid level here, maybe confuse you a little bit more. I thought that's what urea, I didn't read it all the way. That's urea nitrogen, not uric acid. And so they could have put that in there to confuse you a little bit more. But if you study this and you really just use this vignette, it's telling you a vignette about pseudo-gout. And this is from the Step 2 CK Maker. So if you study all this, you can get a nice little vignette for Step 2 for pseudo-gout in your back pocket. But really all you need to know, x-ray of the left knee shows calcification of the synovium. We are done. I answered this question in 3 seconds with you in the beginning. You don't need any more than that. If you start getting these reps, you start studying how the test makers make it, you will score big on test day. I want you to remember that questions are your flashcards. I want you to focus on your floor, and I also want you to win the day. It doesn't have to be perfect. Seldom is anything in medicine perfect. Seldom is anything in life perfect. Everything can always be worse in life, and everything can always be better in life. And that's my argument. People are like, oh, are you an optimist or a pessimist? I'm like, I'm somebody who would say I'm an optimist, but I also realize that things could always be worse. Things could also be better. That is always true. Things could always be worse. Things could always be better. And so by just being mellow, trying to do your best, win the day, student doctors, I know you're going to score big on test day. I know you're going to open up that email. And when you look at your Step 2 CK score, you're going to be proud of the work that you put in, and it will get you to the next phase of training where you can help care for patients. And with that, I'm going to conclude, and I like to say there is a great, big, beautiful today and tomorrow. Best of luck to you in your studies. God bless. Good luck. Johnny Buckeye Barba out.